If you or someone you love is battling topical steroid withdrawal, you know how relentless the itching, burning, and the flare-ups can be. But what if I told you there is a holistic approach that can help ease these symptoms? And that would be acupuncture. What I do in this clinic is acupuncture for TSW, and I want to show you how it works. Hi, I'm Dr. Mark, a medically trained TCM with a focus on treating allergic and autoimmune skin conditions. For more than 10 years, I've been working with individuals dealing with conditions like eczema, psoriasis, and TSW, helping them find relief through acupuncture, Chinese herbs, lymphatic drainage, and cap therapy. So, if you are struggling with TSW, you're not alone. In today's video, I'm breaking down exactly how acupuncture can help, the key points you should know before starting, and by the end, you'll understand and perhaps get to experience acupuncture for TSW. First, let us talk about why acupuncture can be helpful for TSW. TSW causes intense inflammation, disrupted blood flow, and heightened stress, which all can delay healing. Yes, we know from research that acupuncture can help regulate the nervous system, which is often overstimulated during TSW flare-ups. Yes, acupuncture can also stimulate specific points on the body to reduce systemic inflammation. This video is not about that. I will show you specifically in this video what actually works, in the hope that you will be able to replicate it wherever you are in this world. What are the key acupuncture points for TSW? I will give you 5 of them that are good for TSW, and I've seen them being used in the hospitals in China. The first point is Titrate or Li11. This point is great for reducing heat and inflammation. The second point is herbal or Li4. This point, it's great for inflammation and it's great for the face. The third point is Sanjiao or SP6. It's found near the ankle, and this point helps to regulate the immune system and supports the skin. The fourth point is Titrate or LR3. It's paired with the hands. It's great for treating liver qi stagnation. And the last point is yin tang, which is between your eyebrows, and it's great for reducing stress. So, I just gave you 5 acupuncture points for TSW. They will be helpful, but I do not suggest you go to your acupuncturist and say, please just needle these 5 points. Wherever you are in the world, there will be a good acupuncturist who will be able to help you. Every acupuncturist has their own style, and they will choose their points based on their own style. And they may not include these points, and they may include other points. And all that is good. But my point in this video is that these points are not enough. What I'm about to talk about next is more important if you want to heal your TSW fast. My own experience here in Singapore, where I get inquiries from patients all around the world, is that whenever I try to get them to find an acupuncturist close by who will be able to help, I get 2 responses. The first response is acupuncturists, especially in the UK, saying, no, we're not comfortable putting needles in the skin when you have a skin condition. So that is very understandable, but I really hope that you might be able to show this to the acupuncturist to assure them that this method has been used for over 10 years to good effect, and it's silly for a patient in the UK, in Australia, or in North America to come to Asia to receive this treatment when the acupuncturists in all these places are very skilled. So the difference is that maybe they have not tried this method and seen it to work. If you're an acupuncturist listening here, please consider keeping an open mind. This is not rocket science, and I'll explain how it works, and hopefully you can implement it for your patients. How does it work? Contrary to what you might think, putting microneedles into the red skin of TSW patients only helps with recovery. It causes microstimulation, which then results in an immune response that is detectable within a day. Of course, sometimes a patient's immune system might take a little longer, and sometimes it's rather immediate, and you see a response right after the acupuncture treatment, in that the redness is less intense. What tools do I use? I use microneedles that we use for facial acupuncture. I use the 0.14s and 0.16s. They're very thin, and they are usually used on the face, and we use them on all parts of the body. Remember, we are not needling beyond the skin. We are at the epidermis, and I just tap it in, and that is it. That's the level of stimulation. You do not need to go any deeper. There are different types of lesions, but here I'll talk about 2 types of lesions and how to needle them. The first type of lesion is pure erythema. This means reddened skin that can be dry or it can be slightly edematous, meaning it's slightly swollen or wet, but it's red. No erosions. You want to scatter these needles at a certain concentration. It does not have to be too concentrated. About 2 to 3 centimeters apart is a good approximation for a start. The second type are discoid or coin-shaped lesions. These are usually eroded or crusted, so you would need to do a surround the dragon. Any acupuncturist would know this. Needling on the healthy skin around the wounded lesion. Safety considerations. First, start slow. The first session is always important. Do not overdo it. And if you want, you can just patch test. This means needling a certain location, for example, the arms only, and then watching the response. Monitoring a patient's response is very important because different patients respond differently. If the patient responds well, you can discuss with the patient whether or not they want a stronger session. Let's have a discussion on intensity. Intensity is important because you do not want the session to be too not effective, but at the same time, you do not want the session to be too strong that the patient has a negative response before responding positively. In the end, it's a negotiation and it's a discovery. The patient may not feel too comfortable for maybe half a day or one day. This is the severity level. It goes up, which is more severe, and then it gets so much better compared to before they came to the session. I will do a part 2 to this if viewers find this useful because this is pretty long drawn. Leave questions below if you like. Be specific. I'll accumulate the questions and try to answer them. The whole point of this video is that it can be implemented by acupuncturists all over the world and you don't have to come to Singapore.